And welcome to Israel Healthcare Highlights, where we share important information and inspiring stories from Israeli healthcare with English-speaking audiences around the world. My name is Bruce Rosen, and I'm from the Hebrew University in Jerusalem. My special guest today is Dr. Maurit Beeri, the Director General of ALYN Hospital. Welcome, Maurit.
Thank you. So happy to be here with you. Thank you for the invitation.
Okay, I know we have a great topic ahead about the connections between hospital and community and education. But before we do that, please share with our listeners a bit about yourself and about ALYN, which I consider to be one of the greatest healthcare institutions in the state of Israel.
I will not disagree. So I am a pediatrician and I have studied medicine at the Hebrew University in Jerusalem. And as part of my residency, I was sent for a 3-month period to ALYN Hospital, which I did not know at the time. I had nothing to do with pediatric rehabilitation or children with special needs at the time. I meant to be an intensivist treating children with severe illnesses. The first day I walked into the hospital, I saw a physiotherapist walking with a child, holding the walker for the child, and the child shouting at the mother who was at the end of the hall, saying, "Ima, ani olech, Mom, I'm walking." And the mother was standing there, tears streaming down her face. And I said, I want to be a part of this. I want to be a part of the team that changes a child's life, not for the next couple of days, not for the interim period, but for the longest time. And I ended up coming to ALYN, working here as a pediatrician, and then went out to study how to be a manager and executive, and came back as the CEO of ALYN Hospital. Now, ALYN Hospital, for those, the few of you who have not heard of it, is a pediatric rehabilitation center that was started almost 100 years ago by an American orthopedic surgeon who came to Jerusalem, saw that the children were in dire need of straightening their legs, and opened a hospital in Jerusalem. Now, everything has changed since then. Medicine has changed, so now we are treating children who have survived intensive care, neonates, children after accidents, after severe neurological illness, survivors of cancer, burns, war victims, you name it. The children have to grow up dealing with their injuries or disabilities. And this is a big difference from adult rehabilitation, because when you're an adult, if you, God forbid, happen to suffer a cerebral vascular accident or anything else, the work is to get you back to where you were prior to the accident. But with a child who's growing all the time, I like to say that we're playing in a soccer field in which we keep moving the gateposts. So every time we have a new challenge and a new goal. So medicine has changed, society has changed, because now we're talking about equal people in our society who deserve to be a part of us all, and not a subpopulation which could be sent to an institution just, and have a nice life over there. And the third thing that has completely changed our ecosystem is technology. Because thanks to technology, we're all using our mobile phones to interact with people, and we're dictating our messages, and we're moving the world with the tip of our fingers. So even if you are stuck in a wheelchair, so-called, or unable to talk by yourself, we now have ways of allowing you to fill those gaps. So we can promise the children of today who have all kinds of problems a much better future than we could 20 or 30 years ago. And
that's terrific.
Yeah, and we are a 120-bed hospital in the mountains of Jerusalem, and we are a non-profit organization. But thanks to the Israeli system, of which we will soon talk, every child can reach us and come here and get the care that they need.
That's great. That's great. So now please tell me a little bit about the great work you're doing in connecting with the education and between inpatient and outpatient. I know that you're widely recognized both in Israel and around the world for those innovations.
So we're very lucky to be working within an ecosystem which really helps us make sure that the children make the utmost of the possibilities that we open for them. Because a child does not need to learn how to move their finger. They need how to operate a system with which they will communicate with other children. They don't need to move the knee or walk. They need to get from one place to the other. So if they don't go out and integrate into a school where they can actually train and exercise their abilities, they'll be stuck at home, and everything that we reached within our hospital service is going to be lost. So if we weaned the child off a ventilator, or got the child to walk with special equipment, or gave them specific drugs that can help them improve the way that they move, or given them special nutrition, anything we do is just a vehicle to get to the point where they can actually get back and be active in society. So the key word is participation. We want the children to participate. For that, we had to change the way that the education system works, because nowadays, on top of having special education systems, we have integrative system in which we can send a child who is on a non-invasive ventilator, okay, or an invasive ventilator but is mobile, and to integrate in a classroom with children who don't need that assistance. So
Wow.
technology doesn't have to keep the children in hospital. And the way that we work is before the child is sent home, we already have the family training on how to take care of the child at home, being sent for Shabbat every other week or so on. We have the education system set because we have a school in-house. So on top of
Wow.
physiotherapists and OTs and social workers and psychologists, we also have a school system inside. And our school system is already in touch with the prospective classroom in which the child will integrate. Then the child will come back to us periodically to check how they're doing, and we can be in touch with the people who are in charge of them out in the community, the doctors, the therapists outside. So it's back and forth.
That is terrific. It must make such a difference in the lives of hundreds of children each year. Before we conclude, I'd like to hear from you a little bit about another topic on which I've always admired ALYN. All hospitals in Israel try to care for diverse populations, whether it be secular Jews, Haredi, ultra-Orthodox Jews, or Israeli Arab citizens. But I've always been struck that ALYN does it in a special way, maybe because of the people you have, but also because you have people aren't just there for 2 or 3 days or a week, they're there for a longer period of time. I know it's been difficult over the past year since the war broke out every place in Israel, but if you could talk about how it is in general and how you're dealing with the specific challenges now that there's this war going.
I think that indeed we are special in that we have managed to create a place where children come first, no matter where they're from. So as long as you keep that very much in your grasp and think about the children, you can lay aside all the huge differences that we have between each other, whether, as you said, Orthodox or Chilonim, secular, or whether they're Jews or non-Jews. And the thing is that you need to understand that we're all different, and every single one has different needs. When in times of stress, we tend to go back to the people that we belong to and kind of separate ourselves from the others. But when in ALYN, the people that we belong to are like the families are together around their children. So as long as we don't allow them to completely fall back into their safety zones, we can keep it open and have people open-minded. What do I mean? I mean that, for instance, at ALYN, the TV screens in the halls don't show the news, because the minute you show what's out there, you will have parents fighting for whether we're going to see this channel or that channel in this language or other language. So, there's nature programs and children's programs shown. The other thing is that we have the spaces for people to practice their faith. It's not only a synagogue, it's also a prayer room for the Muslims. It's also a special place for non-denominationals. We have a way of working in all the languages. I know that this is accepted practice in the US, and everybody deserves to be spoken to in the language of their choice. It's not that easy within Israel to actually get that. We are very strict about having every single thing in multiple languages so that the people can feel at home and feel that they're being spoken to by their chosen language. Now, this isn't easy to hold all together all the time, and the tensions are real. But if we keep the team integrated, and if we keep the team, working with each other, looking each other in the eye, respecting each other's differences, which is very difficult to do in times of war and stress. We tend to lay blame at each other. But if I'm talking to Mahmoud or to Shane, and I'm not talking to somebody who has relatives in Gaza or somebody who has relatives who don't go to the army. I'm talking to this particular person. And what we have in common is that we work at ALYN together, or that we're worried about the child that is here at ALYN together. We try to keep it on a personal level. As long as we keep it on a personal level, it opens up the space for free discussion and for trust. And this is, I think, the one thing that we lack right now in Israel, is trust.
Thank you so much. You've given us both a lot of information, but also inspiration. Maurit, thank you, and thanks to ALYN.
Thank you for the opportunity.